Dr. Rogalsky from Bay Bariatrics. We're posting a series of videos to help answer common patient questions. One of the common questions we get is, will bariatric surgery help my other chronic medical conditions, or is it really just all about the weight loss? The answer is bariatric surgery will make a dramatic impact in many chronic conditions. Obesity has been linked to over 100 other chronic medical conditions that all improve with the treatment of obesity. There's many people out there who actually think that obesity and diabetes are so intimately related that we should be calling it diabesity. The truth is that it's all driven by insulin resistance, which is a huge risk factor for cardiovascular disease. So sort of starting at the top, you can reduce your risk of sudden cardiac death by 40% by having bariatric surgery. Particularly people who've developed high blood pressure, bariatric surgery is a great option for you. Up to 80% of people will resolve their high blood pressure. That means normal blood pressure without medication. And even those people who don't truly resolve it, they still require high blood pressure medication. They require either far fewer medications, like they don't have 4 meds anymore, they have 1, or they require much lower doses. They go from a high dose of a medication to a low dose. And they're really resolving that underlying problem that's generating the high blood pressure. The other big one is sleep apnea. Many people with obesity stop breathing at night because of obstruction of their upper airway, and they have to wear a CPAP machine, or a machine that helps them breathe at night. More than 80% of people will be able to give that away, return it, put it away and never use it again after the weight loss from bariatric surgery. Diabetes, up to, depending on the surgery that you choose, which you would do in consultation with me or one of our surgeons here at Bay Bariatrics, up to 80% of people will resolve their diabetes. The real big one there too is that you will reduce your chance of dying from diabetes by 92%. So it's a fantastic treatment for diabetes. It works best for people who do it early, so people who get that treated before they start insulin. If you've started insulin already, the good news is that many people can come off of insulin long-term and go back to just medications. And we treat patients all the time who have very high insulin dose requirements, and it becomes difficult to give themselves that much insulin. The good news is those patients will also get a benefit. They'll have dramatic dose reductions in the insulin they need. Lots of other conditions that impact lifestyle are super important. So if you need a joint replacement and the orthopedic surgeon won't do it because of your weight, you can lose that weight this way. It also leads to less joint pain, fewer migraines. Women with menstrual irregularities or PCOS can resolve those. So it can actually, in the long term, positively impact fertility. There's really no organ system that isn't positively affected by the weight loss of bariatric surgery.